It's our honor and pleasure to be hosting the inaugural Entrepreneurship, Longevity, and Biotechnology Conference. This is the first of many to come, so it's just so psyched to be here today. And ultimately, we're all here to make the world a better place, and there's no better place to do it than right here at FAU with the Madden Center of Value Creation.
The Madden Center mission begins with, for society in general, promote value creation as a foundational guiding principle to achieve widespread prosperity.
It's very kind of like unique to the longevity ecosystem is that like it is based on this idea that life is amazing and healthy life is amazing and we want more of it.
And then we also have this exciting array of emerging research and technology in robotics, medical sensors, tissue engineering, biophotonics, artificial intelligence.
Longevity is still very much a small field, so now is really a great time to get involved, but we need more people to come into this space and actually build the next generation.
It's fortitude, it's vision, it's innovation, it's knowledge-based, it's collaboration, and that's what it takes.
I really enjoyed the discussion. This is the level of conversation that we need to have, given the state of affairs in the world.
What inspired you to get into your field?
I didn't really want to accept that, we age, got all these problems, diseases by aging, and that's it. Yeah. So I thought we have to do something against it or something in the field.
I also play a lot of soccer, and I destroy my knees very often. And it kind of fascinated me how they heal back. You have all this bloody mess and it comes back together. You're going to replace the lost parts. If you have an old car, keep replacing the parts, you keep driving it forever.
They're like, yeah. I'm like, well, you're talking about anti-aging. And they were like, yeah. What they were doing was helping Alzheimer's patients, but the cause that they were attacking was aging.
But I think the fundamental idea behind this whole longevity biotech space is we've now gotten an understanding at the molecular level of some of the types of damage that accumulate in our bodies before we develop these diseases, and could we create medicines that target that damage and in so doing prevent these diseases from happening.
This area of programmable medicines, I think, is really a fundamental aspect of how we can address it. It's going to be a critical lens of how we can see diseases, foremost aging, but across the board. And so that's, I guess, why we still do what we do.
If you're able to get this data continuously before anything happens, you wouldn't probably need to visit a doctor's office.
Doing well while doing good is a great thing, and I would say keep your eye on the science, because the science are the tools to get there.
Anything new, any approvals desired, and especially this new fabulous area of longevity needs a campaign. That is how you get to the end. You get to
new tools to develop from them, and to me that seems really exciting, and so that's why I've sort of decided to put my career behind that.
And I would say we've worked really, really closely with advocacy, because so much of what we're doing is building awareness, medical education. It's so interesting to listen to therapeutic companies, but in diagnostics, we're working really closely with physicians and with patients.
Right? So you think to yourself, is this what they're going to do? It's something to think about.